Welcome and congratulations on taking the first step in your total joint experience. Thank you for choosing Columbia Memorial Hospital and the CMH OHSU Health Orthopedic Clinic as your surgery team. I'm Jamie and I will be assisting in coordinating your surgery.
Thank you and welcome. Our surgical team will help you navigate the steps you will take before your stay in the hospital, during your stay, and after you're discharged home for recovery.
Before, during, and after your procedure, you will meet several different members of your surgical team. Some of them will be medical assistants, nurses, surgeons, physician assistants, physical and occupational therapists, and discharge planners.
In the orthopedic clinic, you will review your images or x-rays with your surgeon, and you'll be asked to partner with our surgical nurse coordinator. Our goals are to ensure that you have the best possible outcome. This means you'll need to see your medical provider or establish care with one and have seen your dentist within the last 6 months to ensure your teeth have good dentition. In addition, you may be asked to see other specialists on your healthcare team to ensure you're prepared and optimized to undergo surgery.
Before I was admitted to the hospital, my healthcare team assisted in taking care of my emotional concerns, preparing for my surgery, and preparing me for my recovery at home.
Your surgeon and healthcare team will be working with you to develop a plan following your decision for surgery. This will include a few appointments and/or phone calls, such as a surgery coordination appointment or call with the surgery coordinating nurse, a pre-op appointment where you will sign your consent and we will educate you on what to anticipate before, during, and after your surgery. And finally, you'll have a call with our anesthesia nursing team to perform a final discussion around your health history as you prepare for anesthesia services. Before your surgery, you will need to prepare your home or your recovery space. Things you need to consider include removing tripping hazards such as rugs or clutter where you will be walking, ensuring you have a good chair with armrests. It shouldn't be too low for you to comfortably get out of. Lastly, ensuring you have a bathroom that you can move in and out of safely using your walker or grab bars if they are available. On the day of your surgery, you will enter through the main entrance and check in with our registration team. From there, they will ensure you are escorted to the preoperative unit. There you will change into a gown and be instructed in applying sterile wipes. Your nurse will get a set of vitals and will prepare an IV for medications, anesthesia, and pain control. You will meet your anesthesia provider who will discuss options with you prior to going to the operating room.
Your surgery will take around 1 to 2 hours. You will be provided anesthesia prior to your operation, and your family or health coach will be instructed on where they can wait during your procedure. Next, we'll show you what will occur during your surgery. Your shoulder joint is the connection between your upper arm bone, called the humerus, and the shoulder socket, called the glenoid, which is part of your scapula. The shoulder is a ball and socket joint, which means the end of one bone, the ball, fits into a cup-shaped portion of another bone, the socket. The shoulder socket is called the glenoid. Cartilage covers and protects the surfaces of your bones where they meet. When cartilage wears out, the bones rub together and cause pain. In shoulder replacement surgery, your surgeon removes worn or damaged parts and replaces them with metal and plastic parts. This restores the smooth surfaces of your shoulder joint and helps it move without pain. Your knee joint is made up of the lower end of the thigh bone, called the femur, the top end of the shin bone, called the tibia, the kneecap, called the patella, and cartilage, which is a smooth lining surface that protects the joint. When cartilage wears out, the bones rub against each other and can cause pain in your knee. During total knee replacement surgery, the worn out or damaged cartilage is removed and replaced with metal and plastic parts. This restores the smooth surface of your knee joint and helps it move without pain. The hip joint is a ball and socket joint formed by the connection between the thigh bone, called the femoral head, and the socket of the pelvis, called your acetabulum. Both ends are covered in cartilage, which is a smooth lining surface that protects the bone. Cartilage does not have nerve endings, which is why when it rubs together, it doesn't cause pain. However, when the cartilage in your hip wears out, the bones start to rub together. This area of the bone is rich in nerve endings, and when irritated, can cause significant pain. During the hip replacement surgery, the worn out or damaged cartilage is removed from the hip joint and upper thigh bone and replaced with artificial parts. This restores the smooth surface of your hip joint and helps it move without pain.
Our goal is to ensure you have adequate pain control so you recover faster and avoid complications. We will use several different ways to help you, which include opiate and non-opiate medications. In addition, we will apply ice and elevate your extremity to manage swelling. When your pain is under control and you can mobilize safely on your own, you will be able to leave the hospital. You will need to continue your pain medication along with ice and elevation once you return home. This will help prepare you for any outpatient physical therapy that you may need following your surgery. Here are some things to remember for your stay in the hospital. Remember to have your health coach bring your walker on the day you will be leaving. And don't forget to bring something loose to wear home. Most patients can recover at home. However, some will need to go to a rehab center. Our care management and discharge planning team, along with our physical or occupational therapists, will help determine your needs. If you are instructed in physical or occupational therapy after your surgery, it will help you recover more quickly, while also building your strength. You will be assisted in learning how to transfer safely and independently out of a car, walk on your own with minimal to no assistance, and safely go up and down stairs. You will be instructed on what activities you should be performing and what to avoid. You will want to continue ice packs to help reduce swelling and to elevate your surgical extremity at about the level of your heart. Your incision will be covered and you will want to keep your dressing clean, dry, and intact. You may shower, however, we need to ensure that you do not bathe and that your dressing is clean, dry, and intact. We want to partner with you to ensure your experience is as comfortable as possible. Do not hesitate to contact me, your surgery coordinating nurse, if you have questions, concerns, and/or if you wish to simply share about your experience following your total joint replacement.